And working age Nigerians, 35.5 million are employed full-time. That's 30%.
I give you the context.
I give you the history.
I fight fake news with facts.
Kayode. No, Kayode, I will let you talk. Kayode, I will let you talk if you let me talk. Kayode.
That's why more and more Lagosians are tuning in.
500,000 Lagosians.
720,000.
970,000.
Over 1 million Lagosians, they know that if you give me your afternoon, I will give you hard facts.
Sandra, all to going beyond the headlines and focus on the facts.
I am Sandra Ezekwesili, and these are your hard facts.
Hello, Lagos. Good afternoon. I'm Sandra Ezekwesili, and these are your hard facts. First hard fact of the day: 460 confirmed COVID cases yesterday. It's a smaller number than we've been seeing recently. River State has the highest number of cases with 164. Lagos was second with 139. But just because the numbers came down yesterday doesn't mean that they will keep going down if we don't keep taking precautions. And what are these precautions? Simple things. Limit your movement. If you must go out, whether it's to work or to buy groceries, wear a mask. Keep your distance from people. Wash your hands, sanitize your hands as frequently as possible, and get vaccinated. That's our second hard fact of the day. Vaccinations are ongoing. Yesterday, Lagos State started giving out second jabs again. No, sorry, not yesterday. The previous week. And before that, first jabs had already resumed. So yesterday they started giving AstraZeneca, and before yesterday, last week Wednesday, first doses had resumed again. So just go to the primary health care center nearest to you for your first dose. But for your second dose, go to the one where you got your first. Go to the one where you got your first. That's where you'll get your second dose. Third hard fact of the day: voter registration is ongoing. You can register online. Simply go to cbr.inecnigeria.org. I love when I get feedback from people who listen to me and they say to me, Sandra, I registered and it was a smooth process, or Sandra, I got vaccinated and it was smooth. Some people are asking me to give them money for getting vaccinated. I'm like, did you enter covenant? But hey, congratulations. If you got vaccinated because you listen to me talk about it all the time, well done. Congratulations and thank you for listening to me. Fourth hard fact of the day: Eight of Sunday Bogo's aides have finally been freed. SSS arrested them on July 1st during the raid on his home. After that, the court granted them bail, but the SSS apparently delayed to release them. Then on Friday, their lawyers issued a 48-hour ultimatum to the agency, and now they're free. There are 4 others still in detention, but the lawyers say that it's just a technicality, that they'll be free very soon as well. And fifth hard fact of the day: ASU is grumbling. They're saying that the federal government has not honored the agreement they made in exchange for calling off their strike. We don't have any ultimatums yet, but this is a story that needs to be watched closely because you have resident doctors on strike. A general strike by all doctors may be following soon. Now we're hearing complaints from ASU. I'm just giving you a heads up before this becomes a full-blown story, so that if it does, you'll be one of the few people who saw it coming. Well, at least one of the 1 million people anyway. That's what we do on Hard Facts, really. We make sure that 1 million Lagosians cannot be wrong by giving you all the insights into tomorrow's stories today. I monitor them, I bring them to you, break them down, give you the facts, give you the context, and you can form an informed opinion. As usual, we'll start with the big 3 today. We'll talk about the Ondo State government making COVID-19 vaccinations compulsory for all adults. Then let's talk about the Katsina State government banning cattle trucks and livestock markets to curb insecurity. And then we're going to talk about Rotimi Amaechi saying that those who are stealing under Buhari are doing so quietly. There's no community report today, just like yesterday. From 4 to 5, we're bringing you a special program about maternal, newborn, child, and adolescent health. On today's big hard fact, let's discuss the crisis in the PDP. Conflicting court orders, factional chairmen. Is the party in a condition to provide serious opposition right now? And will it be in a position to contend for Aso Rock, the National Assembly, and state houses in 2023? I'll be joined by various party leaders and workers, including Ambassador Desmond Akao, Ose Aneni, and Demola Olarinwaju. As usual, we'll have news updates at the top of every hour. If you need to win on just a minute, you need to listen to every single thing. That way you win. I'll hand you over to Rufai after the news at 6 o'clock for conversations with Rufai. But right now, Lagos, let's bring you today's Big Three.
This is the Big Three.
The Big Three. On Hard Facts.
On 99.3 Nigeria Info.
Should Ondo State implement a total vaccine mandate? And more importantly, can they? Should Katsina State implement a ban on cattle movement and sales? And can they? Is Amaechi's comments about quiet stealing under Buhari praise or an indictment? Those are your big three. Lagos, let's talk. 2 weeks from now, Ondo residents will need proof of vaccination to attend public events. That's our first story. A vaccine mandate, probably with your vaccination card as a passport. That's what the Ondo State government just announced. They say it's necessary to curb the spread of COVID-19. Here's how Donald Ojogo described it. He's the information minister for the state information commissioner. He said, quote, aside from all existing protocols, all residents in the state must be vaccinated with effect from 2 weeks from now. After the expiration of these 2 weeks, evidence of vaccination will be the condition to access public spaces, churches, mosques, end quote. Simple as that. Or is it? When we see a policy like this, we have to ask the same questions that we asked with NIN and SIM integration, for example. First of all, is the timeline long enough to achieve this? Basically, does Ondo State have the capacity to vaccinate all its unvaccinated adult population in the next 2 weeks? Let me give you some data and then you judge. In the first phase of vaccination, up until July 10th, the total Ondo residents who got at least, out of those, 29,635 got a second dose. That's after about 3 months of phase 1. Now, Ondo wants to vaccinate the remaining population in 2 weeks. Now, you have to ask yourself, well, how many is that? Well, Ondo has a bit over 4.5 million people, according to estimates. Now, let's assume that 46% of those people are under 15, which is UNICEF's demographic estimate for Nigeria. That means that about half are adults. So that's a bit more than 2.2 million people have gotten at least one dose, and you still need to wait over 2 million people in 2 weeks. Centers don't work. So 10 days, 200,000 people per day. Assuming 5 hours of active vaccination work, that's 40,000 people vaccinated per hour across the state for 2 weeks. That's more than 800 people per minute. Now, according to the federal government's National Health Facilities Registry, Ondo State 1 health facilities. If all those facilities were administering vaccines, then they would need a bit more than one shot target. Now, I don't have any hard data about how many of those facilities are actually operational, or how many of the operational facilities will be supplied with COVID vaccines. But as you can see, getting that out of Ondo in 2 weeks will require numbers from phase 1. You have to ask yourself if such an effort is possible. And of course, we're on off for 2 million people in the next 2 weeks. But beyond the feasibility of employment, there's also the feasibility of enforcement. Do you believe that the Ondo State government will have the capacity to monitor all public places and ensure that only the vaccinated are allowed in? Those who agree point to mask mandates, for example. No limited seating in buses and public transportation. Has that been enforced? But beyond the enforcement and the compliance issues, let's also talk about necessity. Do you believe that this is a good move? Do you believe this is a necessary move? This is something we've seen them do in other countries, and we've seen that these mandates appear. The USA, for instance, is in a lot of ways the perfect twin study on this. Some states have enforced vaccine mandates for going into public places, and they've witnessed drops in infections. Meanwhile, some state governments are stopping their cities from doing that, like Florida. And they're seeing. But there are those who do not want compulsory vaccine. Because for the last couple of years, we have understood that when there's undeadly authorities should have some power. That's why most countries have such an act. It's illegal to not vaccinate your kid. That's why in some countries, they can enforce proof of vaccination before letting you in. So for those of us who travel, you've traveled with your yellow card vaccination. For some of you who schooled abroad, you had to show that you got all your vaccines before you could you can be admitted to school. You know what I'm talking about. Enough to justify. What do you think about Ondo State announcement? During the news 3 o'clock, you heard High Court stopped the government of Ondo State from enforcing their own vaccine mandate. Because Obaseki had faced public backlash that large gatherings will only be attended by those who have taken at least one vaccine. But somebody in his state came to court, urged the court to order all parties to maintain status to determine if his fundamental human rights have been breached by the policy. And the High Court granted his request. What you wish Ondo? Do you think it can properly enforce? Do you think the state can administer vaccines to all its 2 million adults in 2 weeks? We don't have the number for women back up yet, so everybody call us on 0700-99703-9093. There's 15975 from Otta Farm as our first caller on the show.
Hello.
Welcome,
Sandra. Good afternoon.
Good afternoon.
Yes. Ondo State governor cannot by force a person that doesn't want to collect vaccine. It's not a by force. It's a matter. Me, I don't go to church. Now that mother had 3 years ago. Because of this not collection of vaccine, I go China to import a machine. So nothing concern with the vaccine. So it's not by force. Are you hearing me?
Okay.
So if they are going to do it in this order, I will take them to court that it's not by force to take it. Concerning the cattle ban because of insecurity in Kano, if that one will stop insecurity, I support them. Let them do it. Let them do it. Are you understanding me?
Okay.
So it's like a governor of Ondo State and a governor of Ondo State. It's like they don't join Antichrist. They don't join Antichrist to want to by force or to collect this vaccine. Is it by force? It's not by force now.
Okay.
Thank you very much.
Thank you, Ikechukwu, for calling. Christopher Ikoyi is on the line. Hello, Christopher. Thanks for calling us.
President Sandra.
Welcome. Go ahead.
You didn't say,
Go ahead.
Thank you. Quick one. I want to talk about Rotimi Amaechi.
All right.
If it's true that he said that, is it because Rotimi Amaechi is saying this? We know now that is what is happening in the government. Then I want to thank the CJN asking those 5 state judges that give some conflicting judgment, call them for a meeting, right?
I'm not talking, that's not on my big 3. Where are you talking about that for?
Oh no, PDP now. You know, you said
that's for 5 o'clock.
Oh, sorry, I beg. For Rotimi Amaechi, I want to thank him for his honesty. Amaechi is not my fan, but I want to thank him for saying that. So those supporters of this government who were condemning the other people, oh, they are corrupt. This is a person in the system telling you people they are doing this thing quietly. You know, 2023 is very close. Amaechi want to come back home. So you need to tell his people the truth. So I want to thank him once more. Thank you, President Sandra.
All right, thank you very much. We've got someone who says his name is Buhari. Thank you very much for calling, Buhari. Hello?
Hello.
Thank you for calling. What's your go ahead.
Hello.
Hello?
I'm listening. Okay. Ondo State, the
Ondo State.
government,
Ondo State. Mm-hmm.
and the Ondo State government is not and put such directive against the people because it's against their fundamental human rights. You can't force the person to by force as they must collect a job. That's not it's against their fundamental human rights. So if they are doing I think it's still against their fundamental human rights. So that's what I want to say.
All right. Thank you for calling to say it, Buhari. We've got Lobo Day Felix Oladele who says, is there government presence in all Ondo State communities? The answer is no. How can you enforce law where they don't even know you exist? Lobo Day Oladele, thank you for your message. Sandy Okongwu says, he's talking about our second story. Let's talk to Azubike in Oshodi. Azubike, welcome.
His Excellency President Sandra.
Good to have you on the show.
Good afternoon.
Good afternoon.
Thank you for having me this afternoon.
Yes, go ahead.
Coming to the talking point about Ondo State governor saying that he wants to, and Ondo State, that he wants to enforce people to be taking COVID-19 vaccine.
Mm-hmm.
So I mean, I see it as a joker.
Okay.
Because there's no time that kind of a statement.
Azubike?
Hello?
Yes. Mm-hmm.
So there's no time that kind of a statement will stand because people will not try to listen to him. So let us be watching what the people of Ondo and Ondo State will do with this their governor instruction. If it work for them, fine. If it not work for them, they should take it like that. Thank you.
Thank you very much, Azubike. Let's talk to Eric. Eric is in Lekki. Eric, welcome. Hi, Eric.
Good afternoon.
Good afternoon.
Please, do you know that the Nigerian government is worse than coronavirus? Yes, the Nigerian government is worse than coronavirus. They should know that. Because what we are passing through in this country is worse than even coronavirus. So I don't know why they are bothering people about vaccination and so on. Vaccination is an individual thing. If for me, I don't want to take it, and then nobody will force me to take it. So they should know that. That is my take.
All right, Eric. Thank you for calling from Lekki to share your take. Well, vaccination is not really an individual thing, especially when it's public health. Remember that I said when we're talking about this thing that for the last couple of centuries, when there's a very infectious and deadly outbreak, public health authorities, should have some powers to enforce public compliance with preventive measures, and that includes vaccination. If it's an infectious disease, you could put my health at risk and I could put your health at risk. And if the thing that could help us not put each other at risk is vaccination, then it's no longer individual. It's now what we need to do as a collective, right? We've got Adeyinka from Ajao Estate on the line. Adeyinka, good to have you on the show.
Good afternoon, President Sandra.
Good afternoon. Welcome.
Yeah, nice to talk to you today again. I think I spoke with you once on your program.
Oh, okay. Good to talk to you today.
Yeah, because I challenge your colleague now that you always leave your line for certain category of people. They always get through every time. Each time we try, we don't get through.
I think they're calling with seven numbers at the same time.
That's on a lighter note anyway.
Welcome today.
Yeah, coming to this, our government forcing people to take vaccine.
Mm-hmm.
Can we ask them, in those times that they did the lockdown and they were distributing palliatives, why were they not making it compulsory for everybody to have the palliative given to them? Okay. There are a lot of conspiracy theories concerning this COVID-19. Like one caller rightly said, is a vaccine. It should be a thing of a choice. I don't have anything against it, but I believe I have to keep to all the protocols. So if I have need to get a vaccine, I will go for it. But as it is, it shouldn't be a compulsory thing. They should look for other things. They should look for other meaningful things to tell the Nigerian populace. There are a lot of other present issues that we have to resolve than this COVID or vaccine of a thing. So that's just what I have to contribute for today.
Thank you so much, Adenka, for calling us today. We've got God's Power, who's a first-time caller, joining us from Ilasa. God's Power, welcome.
Good afternoon, Sister Sandra.
Good afternoon, welcome.
I want to contribute to your program.
Yes, please, go ahead.
There's a question I want to ask, and I want everybody to listen to me, all the listeners that are listening to me now. Why is it that in Nigeria, they allow our doctors to go on strike? They don't even care about our health. They don't even value human life. Why are they so interested and make it so compulsory that we must all be vaccinated?
Because they care about human life?
No, they don't care. In Nigeria here, our government don't care about human life. Yeah. I mean, the people that terrorists and bandits on government are killing are more than coronavirus, and they don't care. Our president flew to foreign land to go and take care of himself, and banned us in the Philippines here. All our doctors are on strike. So why are they forcing us to take vaccine? Why are they so interested? There is no food, no light, no road, no employment, no education. They destroy our education. They don't give us future. So why are they so interested? Why are they so interested about our vaccination? There's a reason for it, my dear sister. Listen to me. I want everybody to listen and listening to me.
God's Power. Thank you very much for calling. I think it's because they know they destroyed the education that they want you to take the vaccine. Because if the education was good, you know that the vaccine was good for you. We've got Comrade Momo Nasser, who is at Sunshine Estate, who says, Does the Ondo State government have the capacity to vaccinate all her citizens within 2 weeks? Human and material resources. This goes to show the capacity of people that rule us. Comrade Momo, thank you very much for your message. Sandra, my wife and I got vaccinated on Sunday. While we waited for our turn, my wife kept reading negative Facebook comments to me, and I told her that Sandra would have told us if the vaccine isn't safe. Aww. Stanley from Chevron with that message. Stanley, that is such a flattering message. I'm glad to read that. Thank you very much. And I hope that you're both feeling well. You may have a fever when you get it, but just take paracetamol and you'll be fine. We've got Wale from Ikorodu who says, with free vaccines we are getting, did Nigeria even have enough to go around? Just read it on the Punch online that the federal government is planning to mandate every citizen to take the vaccine. Yeah, that's the interesting thing. Like, we don't even have enough vaccine for the entire country. That 2 million vaccine. So their population is 2 million, right? And we don't even have we have at least 14 million, I think, and we're expecting a few more, right? So perhaps I guess they could do it, but I don't know, man. Gabriel is in Lekki. Hello, Gabriel.
Good afternoon, Sandra.
Good afternoon. Welcome.
Thank you.
Go ahead.
It beggars the mind to think that a governor will impose vaccination on all the citizens. The coronavirus itself has a death rate of maybe about 2%. That is not the most contagious disease in the world. So this should tell you that there's a lot going on. You see, so much hype, so much, because money have changed hands. These people are they don't even know the truth.
Which money changed which hands?
Listen, from Anthony Fauci and all the proponents of, look, you people should do thorough investigation.
Where are you doing your own thorough investigation from?
Excuse me, please.
Gabriel,
when I finish, you talk.
Gabriel, where are you doing your own investigation from?
You're
doing your investigation from me?
Audience. Listen, you have told your audience how important it is to take. Yes, it's a choice to take it, but you cannot impose it on me. I mean, I've not. It sounds so ridiculous.
Okay. Where are you doing your investigation from about the money that changed hands?
I will leave that for a later date.
Because you got it from Facebook.
No. Well, not Facebook.
Are your kids vaccinated against polio?
My what?
Your kids. Do you have kids?
Yes, I do.
Are they vaccinated against polio?
Yes, they are.
Are they vaccinated against tetanus?
Yes.
Are they vaccinated against whooping cough?
I think so.
So, thank you for calling me. All right, let's move to our second story because we don't have a lot of time, right? Now, to reduce insecurity, the Katsina State government is banning livestock markets and the trucks carrying cattle. We've been covering the insecurity in Katsina for months now. We've noticed that the growing frustration from Governor Aminu Bello Masari. Before now, he told the citizens to defend themselves, right? Because according to the government, the people cannot depend on the federal government's security agencies to protect them. And now he has gone a step further. His government has identified activities that they say are contributing to the insecurity or activities that the armed gangs need. So now they're banning them, and some of the banned activities include buying fuel in jerrycans. Apparently the armed gangs operate from the bush. They come out to buy fuel in large quantities in jerrycans, and so now nobody in Katsina is allowed to buy or sell petrol in cans. Also, only 2 stations in the whole state are allowed to sell more than 5,000 naira's worth of petrol to a single customer. So that's one. Buying and selling or transporting firewood from the forest is also banned. Again, this is allegedly one of the activities that these armed groups use to make money. And then they also banned transporting of cattle in trucks. Again, we've seen in the past that many of the armed groups terrorizing Katsina State own cows. In fact, the last time Masari negotiated an amnesty with the armed gangs, one of the demands was access to the livestock markets so that they could sell their cows. And speaking of livestock markets, they're now banned as well. There's also a curfew for Okada and Keke. They can operate, but not overnight. And when you look at that list, when you look at this list, it paints you a very interesting picture of who and who or who and what the Katsina State government thinks is behind the insecurity in their state. They're cracking down on very specific economic activities, which means that they believe that the criminals and terrorists are very active in those particular activities. But just like with vaccine mandates in Ondo, we also have to talk about enforcement. These are very broad, very serious bans, and they will affect lots of people, not just terrorists. For example, imagine no longer being able to buy fuel in jerrycans, or imagine if you are an innocent cattle rearer who now no longer has a market to sell his cows, cannot transport them out of the state by truck. So it's going to be interesting to see how well the people of Katsina receive these bans, whether they'll applaud them, whether they'll reject them, whether or not they'll cooperate with the authorities enforcing them. And there's also the question yet again about the capacity of the authorities to enforce the bans. Because, I mean, if the bad guys are armed, how easy is it going to be to stop them from doing certain things? What do you think, Lagos? Yes, you can still talk about the first story, Ondo State's vaccine mandate, 0700-993-993. Let's go to WhatsApp where we have some messages, and then I'll come to the phone lines and talk to Pius. Gozier says it's quite unfortunate that a state governor could give such a tyrannical decree showing that he doesn't regard the fundamental human rights of the people. If it's a sane state, this should lead to his impeachment. Okay. Ngozi from Ikoyi says, as long as companies that manufacture these vaccines refuse to take responsibility of any adverse effects emanating from it, nobody has any moral justification to force it on people. All right, Ngozi, thank you very much. Madam Sandra, I salute you. It's not a must that vaccine must be taken. Christopher from Egbeda with that message there. President Sandra, I don't like Amaechi, but I think he has just confirmed what we knew all along. However, have you ever wondered why he even opened the can of worms? I guess we'll soon find out. Nigeria is a sweet drama. That's a message from Stephen in Victoria Island. All right, let's talk to Pius in Ikorodu. Pius, welcome.
Hello, good day, Madam Sandra.
Good evening, sir. Welcome. Go ahead.
My question is on this vaccination. Can a hungry man take a medicine?
Yes, no.
If hungry man, somebody that never eats his money.
He can take medicine now.
Can he fainting?
Yes, no. Can take vitamin C.
When you are fainting.
You can take vitamins. You can take multivitamins.
No, this is the first time I'm hearing this.
Yes, now you can take multivitamins.
Even Christ, before he preached, he feed his disciples, he feed his congregation. Though. This country should make sure they feed the populace before they do anything. Thank you.
All right. Thank you, Pius, for calling. Let's talk to Emmanuel very quickly. Hello, Emmanuel. Thank you very much for calling. Emmanuel, hello.
Hello, Sandra.
Thank you for calling. Where are you calling from?
I'm calling from Abidjan. I'm a first-time caller.
Good to have
enjoy
you here.
all of your shows in Nigeria Info.
Thank you.
Sandra, just like a number of other callers have been saying, right? See, in as much nobody is ready to take responsibility for whatever happens. In fact, you have to send an indemnification that you are responsible for yourself. So it's a matter of choice. But more importantly is this, Sandra, just like someone said, you may not have all of the facts, though he said money must have changed hands. I can tell you for free that a lot is actually going on, and probably there is some merit to how many people are eventually being vaccinated, or how much vaccinations are actually pushed to each state, and there is a bit of maybe merit or whatsoever. I'm not saying I'm right, but let me quickly point something clear to you, Sandra. The moment or until we start to do the right thing in this country, we'll actually be majoring on things that are minor. Things that we should actually do. It's not as if vaccinating people are not important. But can I say this to you? I'm being privileged to have traveled out of this country in the last 1 week, and I came back 2 days ago.
Okay.
All right? Now, went to neighboring country in Cameroon here. Sandra, it surprised you to know that at the point of entry, we are not less than 200, at least I can say, with different aircraft that landed at Yaoundé Airport. But do you believe that the government there, I'm not talking about private entities, though, I'm talking about the government of Yaoundé, their public health outlets, their staff are on ground to make sure that everyone that enters that country gets tested. The PCR rapid testing was done on us. Aside that, they monitor us to the event where we were, and they make sure even at the exit of the country, we were all tested for free, and our results were given to us. Even the tests that we were able to do in this country before we were allowed to travel, we were mandated to pay for it.
Why did you not reject the testing and the mandatory testing? Why did you not reject it?
You mean the one at Cameroon?
Yes. Why didn't you reject it?
That is testing. Is different from vaccination. I'm going somewhere.
Is that not a choice too? That's a choice too.
It is. But I'm going somewhere, Sandra. But you will now to believe that when our government and in each state, especially where we have major international airports, should be doing the right thing by making sure that, because even by enforcing this one, a lot of people will be engaged because stipend can still be paid to them as long as they are working. But I'm talking about staff that are working up until late night. As long as aircraft are still landing at the airport, they cannot close, they cannot go. But now the reverse is the case in this case. Now we have government in Nigeria that are actually making, releasing mandatory portals where you are expected to only fill forms, no testing is being done, and you must pay. If you don't pay, you can't actually proceed to your house as long as you have actually traveled internationally and you are entering this country. Is that what we should be doing?
Can I ask if you're isolated? Are you in isolation right now?
Yes,
okay. Continue.
But we are not doing the right thing. Because if you are actually at the point of entry and forcing people to get tested, that will reduce even the risk.
Now,
so why should we now come and be enforcing people to get vaccinated when we don't even have the capacity?
Now, you yourself said testing and vaccination are different things. So why are you using point of entry testing to judge vaccination?
Because that is actually more easier to actually control this spread.
It's easier to control entry than to control vaccination?
See, you're not getting it. Well, okay, in the first place, you remember vividly that we actually didn't have this, we didn't manufacture it here. I'm talking about the spread of COVID itself. It was actually through the entry point. But because we failed to do the right thing, we are majoring on collecting money from people, and the money that is not being accounted for.
So if we ensure that people here are vaccinated, if people coming from outside the country with the virus, are they going to be able to infect the people here?
I agree with you, but it is based on what people see. For instance, I have never actually engaged in any of these conversations until I've actually now seen for myself what is really happening. Because in neighboring countries are actually more or less regarded than regarded less to Nigeria. They are doing the right thing. They are staffs. Or the people that even put on this particular exercise are not complaining. They are not asking you for money. I can bet you that even in Nigeria...
But nobody is asking you for money for vaccination.
Oh, you think so?
I know so, because I went to get vaccinated. Right. We've seen how vaccinations are being administered here. It's being done relatively smoothly. Nobody's extorting money. So, I mean...
In Nigeria, everything...
If it is free, if you're not being asked to pay for the vaccine, well, where is the racket?
Okay. I've heard you, Sandra, but I just need...
You didn't answer me. You just said I've heard you. You didn't answer me. But thank you for calling. We've got Ade in Bagada who has been waiting for a while. Ade is a first-time caller. Ade, welcome.
Hi, good afternoon.
Good afternoon.
Yeah, so I would like to contribute to the discussion.
Mm-hmm.
Yeah, so talking about the COVID and the different opinion that has been given, I would like to ask, you said this particular disease is very infectious, and this disease in question is over 1 year now. So what's the total number of infected persons in Nigeria?
Tested so far?
Yes, for 220 million or whatever population we have this.
Hold on, I'm going to need to look at numbers from NCDC itself. But go ahead with your thoughts.
For at least the last time I checked, I'm not sure that we have up to 200,000 people infected.
Up to 200,000 people infected? That's not true. We have more than 200,000 people infected.
Okay, but it's not up to 500,000.
It's actually...
Anyway, I have an idea what the figure be because I no longer track it. What I'm trying to say is that COVID is not highly infectious. That's from my own perspective.
COVID is actually highly infectious.
If something is highly infectious, and after 1 year, a population of 200 and densely populated don't even have up to 500,000.
How many of them are getting tested? Do you know how? If you go into a market and ask them, how many of you have lost your sense of taste? How many of you have lost your sense of smell? How many of you have had something and you thought it was malaria and you treated malaria and it didn't go?
But it's not fatal. I understand what you're saying. But it's not fatal. It's not as it's been portrayed.
It's fatal. It's fatal for some people. And because you don't know that you are not one of... Come on, Rachel Oniga just died from this thing. The PDP chairman in Lagos State just died from this thing. Abba Kyari, the president's former chief of staff, died from this thing.
Yeah, well...
And these are just a few of the famous ones. So how many of the people that are not famous that have died from this thing? I have colleagues who have died from this thing.
Condolences on that.
I have family members who have, like, what are we even? Nah, you guys.
Apologies on that. So, okay, I will leave that because it's highly debatable. But another point is the COVID vaccine.
It's highly debatable. It's not debatable, it's fatal.
Japan just stopped. Sorry, what did you say?
Go ahead. Mm-hmm.
Okay, Japan just stopped administering the vaccine to their populace, because of perceived contamination and all that. So how we handle that in Nigeria, how we show that what is being administered to people are not, how they be handled. I have a couple of people that they rather travel than get the vaccine, and somebody is telling me that I should subject myself to a non-FDA or recently FDA approved vaccine.
Well, I was vaccinated in Nigeria and it was a pretty smooth process. It was pretty transparent. I trust the system. I got vaccinated here in Lagos in Igbo, so make of that what you will.
I understand. Anyway, I know, as I said, I will just leave the conversation here, but what I'm just saying is, I think at some point you put it to someone that where do they get their information? Don't also forget that the entire worldwide mainstream media is controlled by only very few corporations. So they project everything that they want us to hear. And I can bet you a lot of people are already brainwashed. You don't even have alternative, constructive information.
Can I ask you something?
Please do.
Do you have children?
Of course I do.
Are your children vaccinated?
I know that's where you're going. But, okay, so one is vaccinated, one is not vaccinated.
Did you test the vaccines?
Did I what?
Did you test the vaccines?
But they've been tested for years. They've been on. This is a disease that just came less than 1 year.
This is also a disease. This is also a disease. This is also a disease.
Let me just
Ade, this is also a disease that the entire world. Hold on. This vaccine. Yes, it came in 8 months. Ade, yes, the vaccine. Ade, yes, the vaccine came in 8 months, but the entire world repurposed its resources towards getting a vaccine, and that's why it came quickly. Do you know why vaccines take so long to come out? Because people are working on different things. Hold on. The reason that vaccines take long to come out is money, not because the vaccines need that length of time. Because everybody's money went to the same pot. All the researchers, all the scientists were working on a vaccine at the same time.
I do not agree with you.
You do not agree with facts?
There's more to that. The cancer, there are other diseases that existed for years.
Exactly. And as a result of COVID-19, all of those as quickly as possible and reopen the...
You know, we can't exhaust the conversation at this time, but what I'm saying is there's more to this vaccine.
I can't change anybody's mind who is made up, to be honest with you. I feel like it's a conversation that your mind is made up. You think a certain way, and then it's not helping that a lot of misinformation about this vaccine is out there, and you also have some voices that you trust, which you should trust, that feed you with some of the misinformation. Their money into making sure that a vaccine would come out as quickly as possible. That's the simple explanation. The vaccines that have taken years come out because the vaccines themselves need to be tested for years. You can actually finish tests for vaccines in a couple of months, 6 months. By the time it comes, you already the long-term effect going to be. And sometimes you don't know the really long-term vaccines are going to be. We didn't have that with this situation because everybody put COVID-19 as priority. Headed towards one place. Everybody was trying their best. It was China. In 2020, the economy tanked. And everybody had to do what they could. The countries who have money and resources, everyone had to do what they could to the world to reopen. We have all the best brains and all the money and research in the same room. Trust me, any assignments where you get, it will come out sharp. After phase of trial for this vaccine before we now have these ones that we're currently using. I promise you, if you step away from the Facebook posts and the WhatsApp videos, if you step away from them for a second, you will see that nobody is trying to get you. I promise you, no one is trying to get you. Let's move to our final story on today's Big Three. We'll look at what Rotimi Amaechi said about stealing in government and the controversy around his words. He's, of course, the transportation minister. He gave an interview to the Daily Trust where they talked mostly about what the economy and security. Mostly Amaechi was that situation. Then when the topic of corruption came up, and Amaechi said something very interesting, the people ran with that particular very interesting thing. He said, quote, "Can you openly take money in this government? In the past governments, what happened? You can take money in the streets. Corruption was so pervasive that nobody was talking about it. It was not hidden that people completely and openly displayed their wealth. They did not have a carpentry shop, but they were billionaires. They did not hide it. But here, if you're stealing, it is done quietly. I'm not saying it is good. It is a sin, punishable." End quote. If you're stealing, it is done quietly. Now, the PDP has responded. By the way, at 5 o'clock today, we're going to be talking about the crisis rocking the PDP and whether the party can get its house in order ahead of the 2023 polls. I'll be talking to party lead like Ose Aneni and Demola Olarewaju. But back to their response to Amaechi, they said, quote, "The confession by Amaechi exposes why the APC administration has failed to recover over 25 trillion naira reportedly stolen by APC leaders in various government agencies." End quote. Do you think the PDP's interpretation of Amaechi's comments are correct? Or do you think it's uncharitable? Come on. Amaechi is saying that out of fear of President Buhari, people in government who want to steal are doing it. Whether that is good enough or whether that's something minister should present as an achievement by his principal. Is that really a flex? Shouldn't the flex be that even if you steal quietly, the president will catch you? What do you think? Yes, you can talk about our first two stories. We told you about Katsina and we told you about Ondo State. 0700-993-993-993. That's the only number that is working at the moment, unfortunately. So women, you have to try that number as well. You can also get across to us via WhatsApp. WhatsApp is 080-959-75805. And there's Facebook, Nigeria Info 99.3. Nigeria Info 99.3. Hello, thank you very much for calling us. Sorry about that. Call back if you can. Hello?
Hello, Sandra.
Hi, how are you? What's your name, sir?
I'm fantastic. Yeah, so Tunji, I'm calling from Lekki.
Oh, Tunji, you waited that long? I'm sorry.
Yes, I did.
Welcome. Go ahead.
Good work you're doing. So I want to see something there.
So
first, I want to kindly correct something you said, if you don't mind.
Okay.
And this issue about testing vaccine for 6 months and then understanding the long-term effect. I think it's actually wrong. You can't test a vaccine for 6 months and understand the long-term effect. You can understand the short-term effect on humans, but long-term, we may not really know. Even the vaccines we are taking now, Fauci can't even come out and say he knows for certain what the long-term effect will be. We all don't know. We are just taking it. So that's number one. Number two, I think this issue with Nigerians and the vaccine is not really about the vaccine itself. It's about trust and sensitization. We don't trust our leaders. These guys have disappointed us over and over and over again. It's easier for say maybe a Singapore government to say, people take vaccine and they'll just go out and take it. Easier for Australians to do. But for our leaders, for an average Nigerian, they're already thinking, as the governor taking money from X place, as they are someone giving them money to make that pronouncement, has he taken a cut, even though he has not taken. But the fact that we've been beaten over and over and over, so there's something this thing does to the psyche of citizens. Even when something is right, the first thing that pops in our mind is this thing. So if an average Nigerian politician tells you it's day, you better check if it's night. So that's the number one issue, and I think we don't have enough sensitization. So there's a lot of questions unanswered. So people are asking, you take the vaccine, but you still can get infected by COVID, even though you can't infect people. So all of those gray areas, I think we need to spend a lot of money doing sensitizing people, educating people, really informing people. Let people who have trusted voice come out and educate the citizens, not governors. We don't trust governors.
But the leaders did not invent the vaccines. We've seen African Union and COVAX and the U.S. government bring the vaccines themselves to us.
We oftentimes citizens see what is in front of them. So it's not it's not the U.S. government coming to vaccinate Nigerians now. So it's Nigerian government, even though we've gotten it from. An average Nigerian does not even believe if indeed those vaccines came from where they came from. Okay,
so are we saying that our government swapped the real vaccines with the fake ones? Because, what will they gain from that?
Sandra, our government is capable of
what will they gain from that? At least there's gain inside for them now.
Okay, let me ask you a question. What will the government gain from what is happening right now in the north? What will the government gain from not doing anything about what is happening in the north? Even though they know it's affecting the economy. Okay, let me give you an example of what happened years ago with Pfizer in Kano when they tested that meningitis drug when they did trial on the people in Kano and people died. Who was held accountable? Finally, they settled out of court. Gave people some money. Did the money even get to the parents of the children who died? And I'm not saying a lot of things that we've said about the vaccine, especially from you, is very right. I'm not saying people shouldn't get the vaccine. I'm just saying that the root cause is what we are looking at. People don't trust anything that comes out, proceed out of the mouth of the Nigerian politicians. I'm saying let these people get the politician out of the way, put trusted voices forward. I wish we still had people like Dora Akunili. If a Dora Akunili was telling me to take the vaccine, I won't ask again. I wish we still had people like that. Let this government think. Let them get out of the way and put trusted voices forward. That's how we can get the people to take it. But if Akeredolu is telling me to take a vaccine, we all know what these people do with their state and the funds they give to them. And I'm pleased. So I think that's the thing. And I think we need a lot of sensitization. Let people really know. Let people know what you're taking. Let people understand the effect. Let's get information. So thank you so much. That's my whole little contribution.
Tunji, thank you so much for calling. I should say, of course, that Pfizer was the one that made that error in Kano, and it was Pfizer that settled. But thank you so much to everyone who's called in to contribute. We're going to take a look at WhatsApp and Facebook messages as quickly as we can, and then we'll move on from that. We have a comment here from Lekon. Lekon says, are you saying that it is impossible to develop a vaccine in 8 months? So because 60 years ago, it took 10 years to develop a vaccine, you now expect that 60 years later, science is still at that same level? By the way, are you familiar with the difference between mRNA vaccines and previous vaccines? mRNA vaccine technology makes it possible to develop a vaccine quickly. It just so happens that mRNA vaccine technology came to maturity in the last couple of years. In many ways, we are actually just simply lucky. Yes, the only way to determine the long-term effects is to have vaccine in use for long term. But all of these things that people are afraid of is simply because there's too much misinformation out there. All right. Thank you very much, Lekon, for your message. We've got more people who are sending us messages in. Sandra, the distrust of Nigerian government is so bad that Nigerians will rather die than commit suicide. What does that mean? Kenny had to join with that message. Sandra, are you telling us to believe that Ondo State has the capacity to vaccinate its citizens in 2 weeks without collecting money from anyone? Well, I'm not telling you that they have the capacity. I'm asking if they have the capacity. Unfortunately, it's 4 o'clock, so my time is done. This was very hot. I think we're going to have to do this maybe next week on the Big Hard Fact. We'll take a look at this again. I'll bring back one of the researchers for the Pfizer vaccine, Dr. Onyema Obuago, Nigerian doctor who moved to the US, so he can come and talk to us again sometime next week and answer a few of the questions that we have about the COVID-19 vaccine. I'm Sandra Ezekwesili.
Hello, my name is Ronke from Ikorodu.
Hi, I'm Emeka from Festa. My name is Ahmed from Apapa.
I want to tell you about my radio. My radio is my best friend.
My steady companion.
My radio keeps me informed
all day long with hot topics, trending news,
politics, and current affairs.
My radio gives me the best music.
My radio is Nigeria Info.
Everybody in Nigeria listens to Nigeria Info.